Okay, my friends, I was going to get extremely deep into the chemistry and so forth, but I will wait for that later. But the whole story here is there is a cure for cancer that's being missed. It's this anti-neoplaston, and this goes way back. And I've been studying demethylization and all of the very deep intricacies of turning on and off gene expressions and the GC islands that are the programs that control us. They are our DNA. They call it junk DNA. There's 98% or something like that is what they think is junk DNA. It has no reason. It's there to be turned on and off by these promoter codes and these demethylizations. And I'm going to show you that right now. And it's going to be upsetting. Okay, my friends, this may upset you a bit. What if I told you that there was a cure for cancer about 42 years ago, and it was known that it worked, and it still hasn't been approved? Let's listen to this. This is Dr. Brzezinski, and they tried to destroy him. So let's just listen to it. It's very interesting, only a couple minutes long. And then I will explain to you exactly what he did and exactly how it does work, in my opinion. I'm not telling to treat anybody. I'm just saying I think he was right, and apparently they are going to approve this treatment now after 42 years. That's the thing, anti-neoplaston. And I'm going to explain to you what it is and how it works. Well, you'll see what they did.
I've had no chemotherapy. I've had no radiation. I chose Dr. Brzezinski instead after a lot of research.
FDA is the problem. Phase 2 clinical trials, remember that. They continued after him, court case after court case. Just recently they're going to approve. And more of this stuff is in final approval, as you can read. Now look at this, where do you see this? That's 2019. Go on, shortly after. 6 months. There it is. 9 months. Alright, now I'm going to show you something. Okay, well, what Dr. Brzezinski was using was anti-neoplaston. So I said, well, what are they made of? They're chemical compounds that are in your urine and your blood. And they are made of amino acids, the building blocks of proteins, totally natural, and peptides, which are compounds made of 2 or more amino acids. So they are, in my world, enzymes. So when used in research, anti-neoplastons are made from chemicals in the laboratory. Well, they're not made in laboratory in us. They are made by, I believe, bacteria that create enzymes. And the enzymes make the antiplastons. All right, this goes back to 1998. And this is the same stuff, this anti-neoplaston treatment, advanced hepatic carcinoma. This is a liver cancer. Advanced means the guy's going to die any moment, literally. And this same stuff, this anti-neoplaston A10 injections, they inhibited the human carcinoma cells. They inhibited them in vitro and showed minimum adverse effects. Right? Advanced HCC is hard to control because the potent anti-cancer drugs or embolizations easily induce hepatic failure. So the drugs they give you to fix you, chemotherapy, kill you. But this other stuff has no adverse reactions, and it does this strangulation of the tumors. All right? Because here's what it says. They reviewed 2 cases with advanced liver cancer treated with this stuff, this anti-neoplaston. Both cases shows interesting response. Interesting response. What was interesting? One showed massive coagulation necrosis. It killed the tumor after intra-arterial infusion. It killed the tumor. The other showed resolution, which means it solved it. It cured a portal vein tumor thrombosis with systemic infusion. They put it right into your system of this anti-neoplasm. There's no side effects. This is very hard to have to say this. This is over 20 years ago, 1998. And they went back, I think, 20 years before that. Distressing. So I said, well, what is a coagulation necrosis of a tumor? So guess what? Coagulation necrosis is most commonly caused by conditions that do not involve severe trauma, so you don't have to cut anything or smash anything up. They don't involve toxins, so you don't have to shoot any drugs and nasty stuff, or an acute or chronic immune response. So they're not shooting anything in that makes you explode or kills you or cuts you or any of that stuff. So this coagulative necrosis doesn't seem like it does much bad. What it does is the lack of oxygen, which is called hypoxia, causes cell death in a localized area. A localized area, coagulative necrosis. It stops feeding blood, that's what happens, which is perfused by blood vessels. So it stops the blood vessels, failing to deliver primarily oxygen or other important nutrients, and it causes cell death. Causes cell death of that tumor. Now, that's pretty interesting. And it doesn't have any severe trauma or toxins or acute chronic immune responses associated to this coagulative necrosis response. And where did we see that happen? Okay, well, we saw that happen, obviously, during the treatment of these advanced liver cancers. Now, I have been saying right along here, a couple of weeks ago, or a week or so ago, I put this up. Bacteria and cancer are linked. It's almost a direct link between the bacteria that's in your body creating what's called enzymes. The enzymes do that stuff and go out and strangle tumors and things. They create the chemistry that deals with these invaders. That is the trigger for your immune system. And the bacteria in your body is being killed by glyphosate, one thing. I've been in contact with Stephanie Seneff, the world-leading researcher in glyphosate, and she agrees 100% that, well, I agree with her 100%, let me put it that way, that the glyphosate is a bacterial killer, and you need the bacteria in your body to be healthy. She also agrees that the autism can be a possible effect from the MMR vaccine because that kills the bacteria in your gut. The bacteria in your gut is the most important thing you have to keep you alive. And they have found that, and we have literally cured autism, for the most severe autism, by infusions of bacterial gut bacteria. Probiotics, basically, is all it is. Nothing exotic here. Now, the most important thing is bacterial fecal transplants, they call it, where they inject into you, not inject, like with a needle or anything, but they infuse like with an enema all of the necessary bacteria that's in your digestive system. And if you can't digest the foods that are coming into you, cannot get the products out of them. Case closed. And we are so destroyed in our guts now from antibiotics and these vaccines and just the basic lifestyle that we live and the different foods that we put in our body and this glyphosate and all of these GM, crazy chemicals that we're putting in our stuff now. I don't want to go crazy again. Everybody, you're always starting to rant. Well, I can't help myself. The rant just comes out when I start thinking about what we're what's been denied and what's been overlooked and it's fought against, absolutely fought against with venom. If they have a position, that position does not change. It just doesn't change. Just as I forget who it was. I think it might have been Max Planck or somebody says, science advances one funeral at a time. And boy, is that a fact. I love you. God bless you. And put God back into your life, too. That's another thing where you got an issue. All right? I love you all. Bye.